our main observation is that there are uncertainties about vaccines, their safety, but also their benefits among GPs, which was a rather surprising result. This uncertainty is driven by, I would say, three main factors. First of all, some GPs perceive that some vaccines are not safe enough. Let's say, for example, the HBV vaccine or the vaccine against papillomavirus, and even vaccines such as meningitis C. The second driver, which is more important than the first one, is that certain GPs do not feel convinced that some of the recommended vaccines by the health authorities are useful. And I would say even that 25% of GPs in France believe that children are vaccinated against too many diseases. Their attitudes are not exactly parallel to those of the public, but to a certain extent they share, not all GPs, but a proportion of them, a significant proportion of them, they share some perceptions, yes. This is a very important point, and this is exactly the problem, because their hesitancy, their vaccine hesitancy, to use a term which is more and more used, to design these uncertainties, is important for some GPs to the extent that they do not recommend some vaccines as the other GPs do. So there is this might contribute to vaccine hesitancy and to lower vaccine coverage in their patients.